Hello, everyone, and welcome to the Mental Health, Mysticism, and Metaphysics discussion with Mike Ray and Dr. Gil Tivon. As always, I'm your host, Mike Ray. Welcome, everybody, and thanks for everyone who's just joining us, whether you're watching this on Facebook, YouTube, Instagram, Spotify, Riverside, or on our new app, which will be up and running within the next few months, as we have had technical difficulties getting this new app launched, or whether you are catching us later on during a replay and listening to this podcast. Thank you for joining us. Just a quick reminder for the outline of this podcast. First, we will be having the lecture portion of the podcast, and then we will be opening things up to discussion and take questions during the interactive portion of the class. If you please be so kind as to keep yourselves on mute during the totally interactive portion, I really appreciate that. If you do have any questions or comments, please feel free to write them in the group chat. And I will do my best to address them. Or if you would like to remain anonymous, you could just send them in a direct message, and I will, again, do my best to address them. This week, we are starting a new feature on Metaphysical Sciences TV, where each week we will be putting out a video where we answer all the questions that you guys have for us that we don't get to address during our classes, at podclasses. And that includes the mental health, spirituality, and metaphysics talk with Mike Ray, which is my podcast, which will be every Wednesday at 8 p.m. Eastern Standard Time. So you'll make sure you get a look out for the updates for that, and new posts on Facebook and the Facebook group, Mental Health, Spirituality, Mysticism, and Metaphysics. Please join the Facebook group if you have not already for more updates, again, for upcoming podclasses and videos. So in this series, we have been discussing so far, last week, Dr. Tivon went over the process of healing from trauma and trying to accept our reality and the way things are, and to be able to move forward. And today, what we will be doing is we will be doing a continuation of this series of healing from trauma. And tonight, I'm just going to recap very quickly what Dr. Tivon talked about, and then we'll be discussing how we can go about identifying bad habits and replacing them with healthy coping skills, mental exercises or techniques, and other strategies that we could use to combat our negative emotions and feelings while going through this journey of oftentimes painful process of healing. Okay, so what did we learn last week? So let me just bring up very quickly the picture from last week. If I could only find the right one. You guys could just bear with me for just a moment. I'm trying to find the picture from last week where we recapped what we went over. But that's okay. We have some other great slides for you guys. So what we will go over, though, is we discussed that there is a process to healing. And so far, we have touched on a couple of these steps or these different stages in the process of healing. And at first, of course, we have the denial stage. We have the a bargaining stage. And then we have the anger stage. Excuse me if I'm not quoting these in order. And then finally, we have at the end, we had the stage where we were trying to bargain, and then eventually acceptance. So essentially, what we are trying to help people and through these series of podclasses is to really see what it is that can work for all of us in trying to help better our lives quality and our situation, and trying to really transmute or change through this process of what we call transmutation in metaphysics, to take something that is negative and transform it into something positive. We went over a few examples last week. Dr. Tivon covered a lot of topics and answered quite a few questions, one of which was touching the topic of coping skills. The questions were posed about the use of substances or drugs, chemicals, whether they are prescription or whether they are, illicit or illegal drugs, makes really no difference, because it is a chemical that alters, the state of mind or your consciousness, and it is, affecting the chemicals in your brain that regulate, different states of mind. So when it comes to pharmacology, or when it comes to, taking any medication or using any type of substance, mind-altering substances. So, and that's something I have to be clear of. When it comes to using mind-altering substances, they are only a temporary relief. It's only, as Dr. Tivon said, it's just a Band-Aid. It's only a quick fix. Your problems are suppressed for maybe, a couple of hours, or depending on what a chemical is, or how much or how long you're using it for. It could last days, weeks, or possibly if somebody goes on a drug binge or a drinking binge, it could last even months. And all this is doing, it is giving you the feeling that you are trying to get, because you don't just, start self-medicating, for no reason. Of course, the issue is something, deeper. It's not just the substance use that is the issue, because as we discussed last week, there are people who do need certain medications, and they do very much benefit from them. And it is very important to understand that sometimes medication is necessary, and sometimes some people can't live without certain medications, when it comes to certain ailments. So if it comes to a disease or a disorder, and that's very important to note that phrase, or that term, dis-ease or disorder. When it comes to that, if it's a disorder or disease that is related to the mind, why should we view it any differently? Why should we stigmatize it as opposed to a physical ailment? Or because of course this is mental health, spirituality, and this is a Metaphysical Scientist TV. This is mental health, mysticism, and metaphysics discussion with Mike Ray and Dr. Gil Tivon. So we are going to be discussing spiritual elements as well, or spiritual sickness. And of course, that like physical or mental ailments can manifest in many different forms. So something I wanted to share with you guys is a quote real quick. And because we don't have any questions today, and we are going to keep this short, we just want to go over very quickly just some coping skills, or coping mechanisms rather, and mental techniques that we could use to make this sometimes painful journey a little bit easier on this process of healing. So you must master a new way of thinking before you master a new way of being. Now, this relates to something we touched on briefly last week, or Dr. Tivon touched on rather, which is mental transmutation. Mental transmutation is something that I've spoken about previously in my podclasses and lectures, and have wrote extensive and very articles about mental transmutation. Is a ancient technique of changing something that is negative into positive, or positive into negative. That is the most simplistic way to say it. And of course, there are ways to do this. It is, of course, easier said than done when you are confronted with a situation that brings up negative emotions or negative feelings to any degree. Sometimes it is hard for us to hold certain feelings back. So we're going to discuss just very briefly, very quickly, because next week Dr. Tivon will be with us, and he will be discussing further, even more in depth, the process of healing from trauma specifically. But today we just wanted to give you guys a little bit of a tool set, a couple tools to add to your toolbox, and skills that you could use to help as you are going through this process. So one of the things that we have spoken about is transmutation, and the most simplistic way of explaining it, again, as I said, is just taking something negative, turning it into something positive. So something happens, you get upset, and you don't know how to deal with it, and you lash out of anger. Now, that is allowing that negative emotion to then manifest. You were absorbing that energy, that negative feeling, and then is triggering these chemical reactions and these other systems in your body that then can sometimes cause these involuntary kind of reactions that we then will regret later on. So how do we catch ourselves? How do we stop ourselves from even getting to that point, or how do we stop ourselves once we get to that point? Sometimes it's not so simple, and it's something that we really have to ingrain into our minds. How do we deal with something when we're in the actual situation, when we're actually confronted in the moment? What do we actually do? And of course, what can we do to prevent ourselves from even getting to that point, besides trying to avoid conflict, which is impossible, because the conflict is everywhere. It's within, it's without. So unless you have resolved the conflict within you, whatever it might be, whatever reason, or whatever the cause is, which we will get into in a moment, we have to learn how to extinguish that fire. Okay, so one of the techniques is called mindfulness. Now, a lot of people talk about mindfulness, and a lot of times they will speak about just using mindfulness meditations where you just sit and you focus on where you are, you focus on your breathing, you focus on your heart rate, you focus on what you smell, what you are touching, what you feel, what you might taste. You absorb and try to observe with your eyes closed. You try to observe all of your surroundings and you just live in the moment. But of course, that technique doesn't work when it is already past the point and you are upset and you are about to lash out. So what do you do in that moment? Well, mindfulness is something that we can also apply in that moment. While mindfulness technically is intentionally living with awareness in the present moment, for example, waking up from automatic or rote behaviors to participate and be present to our own lives, what we can also do is in the moment we can, and people have heard this one before, we could take a breath, just pause and think, just take maybe a 5-second pause. And of course, in a conversation, 5 seconds isn't very long. It might feel very drawn out, but take 5 seconds and just try to see the situation, see yourself, see maybe the other individual who might be involved in the conflict, or if it's caused by some mistake, if there's some type of internal upheaval within you, and it is causing you to want to act out of anger or out of fear, or act impulsively, from any emotion, you want to try to pause, just stop, and try to step back and really try to see the situation from a bird's eye view, from a third-person perspective. Ask yourself, if this was happening to anybody but me, how would I deal with this? What advice would I give to a person? And what would I tell them to say in this moment? And just try to remove yourself from the situation for a couple of seconds. And then really think about what it is that you want to say and how you want to express what you're feeling, and be careful about how you respond rather than react to the situation. So that answers that question for you guys as to what do we do when we are already in the moment, as opposed to what do we do to stop ourselves from getting to that moment. And of course, another thing we can do with mindfulness is we could use different skills and specific behaviors that when we practice and put together will create more mindfulness throughout the day, so that we are always living with more awareness of the present moment. And these are things that can be practiced at any time, anywhere, while doing anything. Intentionally paying attention to the moment without judging it or holding on to it is all that is needed. There is meditation, is practicing mindfulness and mindfulness skills while sitting, standing, or lying quietly for a predetermined period of time. So you could set a timer, for example, for, say, maybe if you want to start with just 10 minutes or even 5 minutes, just 5 minutes or 10 minutes a day, set a timer where you just do nothing but sit and meditate and try to focus the mind. For example, you want to focus on body sensations or emotions or thoughts or our breath. And we open the mind, just paying attention to whatever comes into our awareness, but without holding any judgment, without holding on to any thought, just letting the thoughts flow. Of course, this is not something that can be used in the moment. This is something you use so that you are able to more peacefully transition into where you are not, depressed about the past, and, downtrodden and beaten down and, just constantly hating on yourself, and you're not living in the future where you're anxious about, what's going to happen, what might happen, what could happen, if, ands, or buts. So you want to live in the present moment. So, again, that is one technique we can use. There's also contemplative prayer, such as for Christian and Christianity. There is Christian-centered prayer, which are like the rosaries. There are the Jewish Shiva, Islamic Sufi practice, or Hindu Raja Yoga, which is a spiritual mindfulness practice. There are also many others. There is Kundalini Yoga. There is just mindfulness meditation, as we just discussed. There is focusing on a focal point. This is something I think I touched on in one of my podclasses, where you take a candle or some type of focal point where you stare at it for approximately maybe 20 seconds, as long as you can without blinking, and then you close your eyes and you look at the after image with your eyes closed, and you focus on that, and that will draw your attention inwards. And as your attention starts focusing inwards, you start to draw yourself closer to, again, what we have discussed and talked about, which is the consciousness of universal oneness, or rather the universal consciousness. And this is a connection that everybody has and everyone can achieve. And as we discussed in a previous podcast and in Your Secrets Revealed Kabbalah class with Dr. Gil Tivon, it is within this state, when we are connected to this universal consciousness, when there is healing and true, what some would call even miracles, that can occur. So we will start discussing that in even greater depth and detail next week when Dr. Tivon is with us. This week we were running a little off schedule, so we apologize. By we, I mean me, myself, and I. But I did just want to go over some coping skills and different practices and techniques that we can use to just try to ground ourselves and keep ourselves grounded, whether we're in the heat of a moment in a situation, or rather if we are in a situation where we know there might be upheaval or there might be conflict, how we can try to keep ourselves in a state where we will be present in the moment, and we will not act out of fear or anxiety or depression, where we are making an impulsive reaction to something that is going on, and we're instead responding to our environment. Okay, now I just wanted real quick to share one last thing, which is something I just mentioned, which is grounding. Grounding is a set of simple strategies that can help you detach from emotional pain. It's basically a way to distract yourself by focusing on something other than the difficult emotions you're experiencing. So basically, just distracting yourself. You can also think of grounding as centering or creating a safe place or healthy detachment. Now, a lot of times people will sometimes daydream, or they will, they will start different tasks, or they will take on new hobbies. So they will oftentimes find maybe not so healthy coping skills. So what you want to do is to try to keep yourself grounded. And of course, we went through a couple ways to do that, which is mental transmutation, mindfulness, meditation, contemplative prayer. And then, of course, there's always exercise, which is, a great way to help with depression and anxiety. There are, other things you can do. You can do something creative to try to channel that feeling and the emotion. And there is also, just the practice of just trying to be more present and being in the moment, and not having these things from our past or worrying about our future, not having these things on our mind, so that when we are in the moment, they do not influence us, so that things don't build up over time. Okay, now I've had a quote up by Marcus Aurelius, who is a Stoic philosopher back from 121 to 180 AD. And what he said here is, waste no more time arguing about what a good man should be one. So that is something to think about, that's for sure. And a lot of people will sometimes, they will wait and they will procrastinate when they're trying to do things. And one of the things about mindfulness practices and these other coping skills that we talked about that are healthy is that we could do them at any moment or any time of the day. Now, I would like to thank you all for joining us again. This has been Mental Health, Mysticism, and Metaphysics discussion with Mike Ray and Dr. Gil Tivon. Today, Dr. Gil Tivon was off, and I taught the class. I'm Mike Ray. If you guys would like to reach out to me, you can find me on Facebook. Just type in Mike Ray. You'll see this picture and with a beautiful woman. And you can also find the replay of last week's podcast, and as well as many other videos, including videos answering and addressing questions, and replays to other podclasses, including Inner Secrets Revealed, Kabbalah class with Dr. Gil Tivon, my mental health, spirituality, and metaphysics talk with Mike Ray podcast, and of course this new series we have of Monday podclasses, the mental health, mysticism, and metaphysics discussion. I thank you all again very much, and we will see you again next week, same time, same place. Thank you all for joining us. I'll see you next time.